Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it.
What is labor? Labor is a process that causes progressive cervical dilation or opening of the cervix, cervical effacement or thinning of the cervix, fetal descent, where the baby comes down through the pelvis, and it ultimately results in birth. Not every contraction means that labor has begun, though. False labor or Braxton Hicks contractions are contractions that are often irregular. They may be regular for short periods of time, but they don't usually stay that way. They're typically mild or painless and mostly very annoying. They aren't going to cause cervical dilation or effacement, and oftentimes hydration and rest will help relieve these. It helps to prepare the uterus for labor, so it's kind of like practice. Labor contractions are going to be more regular. They're going to last longer and they are going to become more intense as the labor progresses. True labor occurs when contractions produce cervical dilation and cervical effacement and lead to birth. So, how do we know it's true labor? We're going to see cervical change. The other things that we can see that do not necessarily define labor are going to be pain level, frequency alone, bloody show alone, water breaking alone, and increased pelvic pressure. So the reason why I'm saying alone is it is a whole picture. Typically, false labor does not produce bloody show. But if you have bloody show, that doesn't automatically mean it's true labor. If you have more frequent contractions, that doesn't automatically mean it's true labor. Even the water breaking doesn't mean true labor. We need to see cervical change in order to know it's truly labor. So these findings support the probability of labor, but they do not confirm labor without that cervical change. So if we compare our contractions, false labor versus true labor, the cervix with false labor is not going to dilate or efface, and we typically don't see bloody show here. With true labor, we're going to see progressive dilation and effacement of the cervix. We may see bloody show as the cervix is dilating and effacing, little capillaries can break that can cause that bloody show that we can see. We also can see fetal engagement and descent with true labor as well. As far as pain or discomfort, with false labor, this is typically felt in the front and the upper abdomen above the belly button. Sometimes they can feel it in the groin, and it is more annoying than painful. Oftentimes, these are mild contractions, and again, more localized above the umbilicus. With true labor, these contractions tend to start in the lower back and radiate to the lower abdomen. They are increasing in frequency, duration, and strength, and they start out feeling more like menstrual cramps. As far as activity and how it can affect these contractions, for false labor, oftentimes this will improve with comfort measures, hydration, a hot shower, resting, walking. All of these things can help relieve or at least decrease the frequency. With true labor, comfort measures are not going to improve the duration and the frequency of contractions. They're actually probably going to continue to become stronger and more effective. So even if we're hydrating and using our comfort measures like the warm shower and resting and things like that, they're still getting stronger. They're still getting closer together. So an example of this would be if a pregnant woman's sleeping and she wakes up because of contractions and moves around. If they're becoming stronger and closer together, that might be a sign that it's true labor. And if they go away, that could be a sign that it's false labor. So for nursing considerations, It is going to be appropriate to know what her cervix is dilated to. So a cervical exam needs to be done in order to know if the contractions are causing the cervix to make change. We need to assess a contraction pattern, and we need to also assess the baby. If contractions are lasting longer than 90 seconds, that can affect fetal oxygen supply. And so that's an important thing to notice and to watch for. And then we're also going to look to see how regular the contractions are and if they are becoming more frequent. We also will assess if the water is broken. We'll assess for fetal movement. We'll assess mom's vital signs as well. If it's determined that it's false labor, if these contractions are not producing cervical change, a lot of the things that we will consider for this is related to education. So we will encourage her to hydrate. Sometimes the uterus can be irritable if she's dehydrated. We'll encourage rest. We'll give her reassurance that even though this isn't labor yet, this could progress into labor, and that it is normal to have these irregular contractions before true labor kicks in. She might get to go home, so giving education as to when to come back and when these contractions are going to be possibly more effective. So again, feeling them more in her back, radiating to her lower belly. Walking doesn't help them, it actually may increase them, things like that. And if it's found that she's in true labor, we're going to continue to assess contractions, fetal heart rate, all of those things. We need to notify provider and admit the patient, and then we're going to offer labor management. So to review, true labor are contractions that produce cervical change and lead to birth of the baby. They become stronger and more effective with walking and activity. They are more regular and increase in frequency and intensity as time progresses, and they continue despite comfort measures. False labor are contractions that do not produce cervical change. They often lessen or stop with walking or position change. They're irregular or maybe temporarily regular and mild, and they improve with comfort measures. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.